So now, if you're queasy about the vaccine, and this is a thing, the biggest obstacle once the vaccine gets moving that we're going to have to face is people who are afraid to take it. There is all kinds of conspiracy theories. There's all kinds of people making stuff up. And then there's just the general anti-science attitude that floats around America. And, we have been seeing it throughout the whole COVID thing. People not wearing masks is anti-science attitude. It's connected to all the, we don't want evolution in the schools, and climate change is a hoax. It's all part of the same project. But the fear around vaccines branches out even farther into, you see it in the health and wellness community, you see it in the beauty industry, and like online influencers. It's all over the place. We have to be, people, first of all, have to get over their fears, but you also got to understand, this is not a regular vaccine. This is brand spanking new technology, okay? Here's the CDC's website for the Pfizer vaccine and the Moderna one are both mRNA vaccines. And guys, this is a huge breakthrough. This is technology, medical technology they didn't think could exist before COVID. And just because of all the money the Trump administration threw at this, if they did anything right, they put tons of money into mRNA vaccines, and they work. And what are they? Messenger RNA vaccines, also called mRNA vaccines, are some of the first COVID-19 vaccines authorized for use in the United States. It's a new approach to vaccines. mRNA vaccines are a new type of vaccine to protect against infectious diseases. To trigger an immune response, many vaccines put a weakened or inactivated germ into our bodies. Not mRNA vaccines. Instead, they teach our cells how to make a protein, or even just a piece of protein, that triggers an immune response inside our bodies. That immune response, which produces antibodies, is what protects us from getting infected if the real virus enters our bodies. Guys, why is it called the coronavirus? It's really called SARS-CoV-2, if you didn't know that. That's the real name of the virus. But why is it called coronavirus? It's because we've all seen the pictures. It's got all these little spikes around it, like the sun looks, the corona, that's called the corona of a sun. When all the beams shooting off, it looks spiky. Those spikes are what make it so contagious. They latch onto your biology, they latch onto your cells, and hang onto the droplets that you spew out into the air, or other people do, very well. Okay? These mRNA vaccines put into your cells the genetic memory of the proteins in those spikes. Look at this. Again, this is the same thing from the CDC. COVID-19 mRNA vaccines give instructions for our cells to make a harmless piece of what is called the spike protein. The spike protein is found on the surface of the virus that causes COVID-19. COVID-19 mRNA vaccines are given in the upper arm muscle, blah, blah, blah. So literally on a cellular level, you are fighting this virus. The cell displays the protein piece on its surface. Our immune systems recognize that the protein doesn't belong there and begin building an immune response and making antibodies, like what happens in natural infection against COVID-19. So this is super important because look, the Pfizer vaccine appears effective against new COVID-19 strain in the UK because it has the same spikes. Okay, this is a new strain of COVID-19 or of coronavirus, but because it's an mRNA vaccine, the vaccine works on this one as well. This is not the same. This is not the same as traditional vaccines giving you a weakened form of the virus. This is very important. We need to get it as soon as we can. I'm still streaming, baby. We need to get it as soon as we can. And guys, if you're queasy about it, if you think is it really okay for us? They shot old Joe Biden, 70-some-year-old Joe Biden full of it. Nancy Pelosi, all these geriatrics, with all due respect, in our government have received the vaccine. They're doing just fine. The first person to receive this in Britain was a 91 or so year old woman. They're doing fine. So it's very important that you take the vaccine as soon as it's available to you, because that's the only way we're going to get back to any semblance of normal and that we're not going to see mass death in the United States from pure incompetence, okay? And this is deadly serious now because the CDC says that the faster spreading COVID-19 strain will likely be dominant in the U.S. by March. In this story, the highly contagious strain could drive COVID-19 cases and deaths even higher. It could be even worse, okay, guys? So please take it serious. Take COVID-19 serious. The vaccine is not scary. It's good for you. We don't have a cultural memory of what life was like before vaccines. We don't see people in wheelchairs because of polio. We don't see people pockmarked from smallpox. Okay, so if you know people who are skeptical of vaccines, go do some reading. Try to help explain it to them. Send them this video. Tell them to like, subscribe, follow Political Pain here on YouTube.com and elsewhere, Twitch, wherever they may be. But yeah, I mean, it's very important that we all jump in on this as soon as we can. I'm going to read some comments, and then, guys, I am going to have to call it a night. Let's see. My wife's home, and I've been streaming for how long? I'm all sweaty. 3 hours and 17 minutes. Woo, buddy. Yes. So let's see. I have some comments. Yeah, they don't even have the virus in them, dead or alive. Yeah, the vaccine does not have the virus in it. It's literally like coding your DNA. It's actually really cool. I know people are going to freak out, but it's actually really, really freaking sweet. Let's see. Yeah, they're not giving you COVID. It's like a flu shot. It's mRNA. A left anarchist channel I like was even putting out misinformation about the vaccine. Blue24, don't be foolish. Yes, to quote Michael Brooks, don't be foolish. Like, subscribe, and get the vaccine, guys.